Do you have wrinkles or creases across your neck and your chest? Or have you ever seen someone who had a beautiful complexion of their face, but maybe their neck and their chest looked about 10 years older? Well, today we're going to be talking about anti-aging tips for your neck and your chest so you can slow down the aging. Hi, my name is Christy Green and I'm the owner of Go See Christy Beauty Boutique located in Southern California, and I have been in business for over 10 years and we have been helping people treat their acne, hyperpigmentation, and fight aging, their fine lines and wrinkles, for over 10 years. So in this video, we're about to talk about anti-aging tips for your neck and your chest. So before we begin this video, I do want to say that all the product descriptions, lists, or anything that we're going to be describing in this video today will be located in the description below. So first, the skin on the neck and the chest are very similar to the paraocular area, and we did a video on how to prevent fine lines and wrinkles and aging around the eyes. So the skin is very similar, and matter of fact, the thickness of the face, the skin on the face, is actually almost double that of your neck and your chest. So like your neck and your chest and around the eyes are the first signs of aging. So for example, this area gets just as much sun as your face does because of the thinness. It has less sebaceous glands, so it does tend to get drier. It has thinner skin, as well as for some people more hair follicles, so there's less structural support. So here are 3 anti-aging tips that you can do to address your neck and your chest. So a lot of times what you can see, or what I see in clients, is a skin condition called Poikiloderma of Civatte. And that's basically a combination of hyperpigmentation, hypopigmentation, and underlying redness. And that usually takes place in areas around the neck, as well as sometimes on the chest. But for some reason, right underneath the chin right here, there's no hyperpigmentation here. And so that's usually more common. It's a sign of low estrogen levels, as well as affected by genetics, and more women tend to have this. It also can be caused by wearing products that have synthetic fragrance, and then when you're exposed to the sun, the fragrance causes the photosensitivity of the skin, so that is usually fragrance-induced hyperpigmentation. So obviously, more women, generally speaking, tend to wear fragranced products. Look in the mirror and you see some uneven skin tone, some areas that are dark shading, no shading on your splotches around your neck, as well as your chest, and even some underlying redness. That's usually what that is. Sometimes women will form that later on in years, and they're thinking maybe it's just a birthmark that started to turn color, but that's actually what that skin condition is called. Here's another factor that most people don't consider as well. If you have done sudden weight gain and loss, and repeated weight gain and weight loss throughout your life, that can also affect the appearance of your chest and your neck. Because when someone, just like any other part of the body that you lose weight and you gain weight, what happens is obviously the skin stretches and then shrinks back. So obviously people who have lost a significant amount of weight, they will have loose skin hanging. So sometimes that can happen to people as for their neck and their chest. What happens is the tissues in the neck and the chest stretches and then goes back, stretches and then goes back. And so by the time they're a little bit older, what can happen is they can have kind of that turkey neck look. There's another condition that has been coined for today, and that's called tech neck. Oh, and don't forget the pro tip later on in the video regards to your neck and your chest. So we're going to be talking about the 3 major anti-aging tips that can help with anti-aging, slowing down the aging process of your neck and your chest. So the first one, we talked about the tech neck. So how you can adjust for that is, obviously we're always going to be looking at our phones, we're always going to be looking at our computers, our laptops, our technology. So what you may want to do is try to be more conscious is that when you're looking at your technology, to adjust your phone. So instead of looking down, you're looking more at eye level, and having your laptop or your computer more at eye level versus looking all the way down. So along with tech neck, your chest can also be affected, because what can usually happen is as you're looking down, you will also start to slouch. So when you start to slouch, what can happen is you're starting to create creases in your chest. And these are called cleavage wrinkles, otherwise known as Langer's lines. And so those are actually vertical lines that go straight down your chest. So another way is to avoid sleeping on your side. So when you sleep on your side, obviously the skin creases tend to concave in through your chest, and so what you want to do to avoid that is try sleeping obviously on your back, and we will provide links below where you can actually put on a gel. It's like a silicone gel that you put on your chest to prevent the skin in between your cleavage to concave. So it basically flattens that out to prevent the breakdown of tissue in between. Okay, so before we get on to our final tip, if you are finding these videos and this information helpful, please give us a thumbs up to let us know that this is the information that you're looking for, and please go ahead and subscribe to us if you haven't subscribed yet. Okay, and if we haven't addressed a specific skincare concern yet in any of our videos, make sure that you comment below and let us know. So if you have eczema, or you have psoriasis, or you think you have sensitive skin, go ahead and put that below, because that will let us know that maybe we need to do some videos that address those skincare conditions. Okay, so our final tip is obviously, the third one, is treating your chest and your neck as if it was your face. So a lot of times people neglect their chest and their neck, and they just do their face. No, you have to continue it on with your chest and the neck. And how you can do that is with services and or products. Okay, so for our final one, consider this 3A, because there's 3B as well. So 3A is services. These are all professional services, and I would recommend that you're doing them in the winter time. So for those of you who are not living in Southern California, where most of your days are cloudy and gray, this is actually an ideal time. It's also colder, so you're wearing sweaters and things that cover up your chest and your neck as it's healing. So I'm going to be talking about services. These services not only stimulate collagen and elastin production that products cannot do, it also has a side benefit of lightening and brightening your skin tone. Okay, so best time to do it is during the winter time. So I'm going to go into from the least invasive to the most invasive. So the one that you can do that's the least invasive is you can do, first one is chemical peels. And because the area is thinner and more sensitive, they're not going to leave on the products on as long, okay? So you can do chemical peels, and you usually, your esthetician or your dermatologist can tell you how many series that you need based on what your skin looks like and the thickness of the skin. So chemical peels is the first one. You can do microdermabrasions, where sometimes, depending again on the person that's doing that, you can kind of blend the two together. So chemical peels, microdermabrasions, microneedling, platelet-rich plasma procedure. I'm not going to go into that one because that is a medical procedure, as well as laser. So, and laser, make sure you get a consultation before you go and do that, because you have to be the ideal candidate to get that done. And a lot of it depends on, based on your skin and your tolerance to, not pain, but as far as where you are on what's called the Fitzpatrick scale. So those are some services that you can look into. Now 3B is basically the products that you can use. So just like we talk about the face for anti-aging, you want to look for products that are high in antioxidants, so especially vitamin C and E, because they work together to increase the efficacy of both of them. And if you're not really sure about that, please make sure you check out our anti-aging playlist, which I will put a link in the description, as well as a card up here somewhere, so that you really understand what ingredients to look for. The other one is, in addition to antioxidants, is you want to look for anti-inflammatories to bring down the inflammation and the underlying redness that can cause the hyperpigmentation. The other one is powerful peptides. So the peptides are very targeted, and they actually have a time to release capsule, releasing the antioxidants exactly where it needs to be, and those work conjunction together. The other ones are retinoids now and AHAs, which are alpha hydroxy acids. Now you have to remember, we did a video on this on anti-aging ingredients you should never mix, because your neck and your chest is more sensitive than even your face. Make sure that there's a link below. You can get the list, or you can watch the video on anti-aging ingredients you should never mix, because what may work on your face, I have noticed with my clients that they will get a rash developing on their chest and or their neck if they mix the wrong ingredients, okay? So, like with your face, so this is tip 3 generally, is that again, you want to treat your neck and your chest as if you are treating your face. So you want to use a facial cleanser if you can, or that's pH balanced on your neck and your chest. You do want to exfoliate your neck and your chest, but because it's more sensitive, stay away from like granular scrubs and use something that's more of an exfoliating powder. And we'll put links below to give you suggestions for that, because they are a little bit more gentle. Use a serum, an antioxidant serum or a hydrating serum. And then for your cream, what is different is maybe not for the face, because again, your face or your neck and your chest have a slightly different needs, is look for these creams that specifically are for the chest and the neck, and sometimes it'll say neck and chest cream or neck and décolleté cream on there. So they have a little bit different, more richer, thicker consistency that you can use on your chest and your neck. So those are your 3 tips. Now during the day, you obviously don't want to use a neck and décolleté cream because it tends to be heavier, it can get on your clothes, and it doesn't have any sun protection. So the one that we love here and my clients love is the Lyra Clinical Hydrating Formula, because there's 2 different formulas. This one has, so it's not just a basic sunscreen, it actually has high amount of antioxidants. It is a mineral-based sunscreen, no chemicals, so it doesn't cause any inflammation or redness. It has powerful stem cells for anti-aging, and the best one, it has natural plant-based lighteners and brighteners. So you can use this one on your neck and your chest. And once again, to make sure that you are not getting any redness, rashes, or flakiness on your neck and your chest, make sure, if you haven't already, click the link below to get your list of anti-aging ingredients that you should never mix. Okay, so here's the pro tip. The pro tip is when you're applying serums, lotions, creams, sunscreens on your neck and your chest, you never want to go down, because gravity is always constantly pulling down. So all the sagging and bagging, we don't want to help it anymore. So when you're applying, you want to go from the base of the neck, lift up your neck, and put the product on, and go ahead and apply it working up as well as your chest, because when you have wrinkles on your chest, they're going down. So again, you want to go up, okay? And then also an additional tip is when you're applying lotion or products on your body, you want to also go from the base of your limb, whether it be your wrist or your ankles, and work your way up. So none of this circular motion. You want to go up and out. Okay, so there's your pro tip. Do I have a turkey neck? You know, I've seen that if you do this, it'll work. Not really.